excited to be here tonight. Thank you guys all for coming. This is one of my favorite topics to talk about with patients and also just personally. Exercise is so important. So this is about fitness for all ages. And we're going to talk about why we kind of all know that exercise is good for us, but it does a lot more than just improving our physical fitness. So we'll talk about how a lifelong exercise program is the best way to help us live long and healthy lives and really thrive into adulthood and older age. So we'll talk about kind of the different seasons of life and why exercise is important throughout all the different stages. And then because it does so much for us, because exercise is so important, we'll talk about how and why regular exercise is important no matter what age we are. It's always important. Okay, so a lot of people think about exercise and just think about the physical fitness, or they exercise because they feel so much better afterwards, but there's actually a lot of benefits to exercise, including the prevention of a lot of chronic diseases. So this is something I try to talk to my patients a lot about, but regular physical activity can actually decrease the amount of preventable deaths. So 1 in 10 premature deaths can actually be prevented by getting enough exercise. And so can a lot of cancers. So 1 in 8 breast cancers can actually be prevented by regular exercise, in addition to 1 in 8 cases of colon cancer. Diabetes as well, so 1 in 12 cases of diabetes and 1 in 15 cases of heart disease. And this is one of my favorite quotes. So this whole slide is from the CDC, and this is a quote from one of their doctors, Dr. Ruth Peterson, and she says, "If we could package physical activity into a pill, it'd be the most effective drug on the market." So it's so powerful to think about it that way, you know, especially something that's available to everybody, physical activity. And these, I know this type is a little bit small, but this really breaks it down into the different age categories. So for children especially, there's a lot of studies saying that regular exercise decreases the rates of depression, it promotes bone health, muscular fitness, and then it improves attention and even academic performance in kids. And then going on to adults, that's where we think about a lot of our chronic diseases. So the benefits for adults of exercise include things like lowering the risk of high blood pressure, lowering the risk of stroke, improving mental health, and then also things like improving cognitive function, preventing weight gain, and also reducing arthritis symptoms. And that can be a little bit counterintuitive. We'll talk about that a little bit later in the talk too, but it can actually reduce symptoms of arthritis as we stay active. And then for healthy aging, we know that exercise improves sleep, it reduces the risk of falls, it improves balance, improves joint mobility, and it also extends the years of active life that we have. Helps promote bone health, and it also, and this is a big one, delays the onset of cognitive decline, which is huge. So the more flow you're getting to your brain, the more healthy aging you'll have as we get older. And then for a little bit of a public health perspective, I did my MPH at the U, and I learned a lot about this perspective, but it's kind of amazing that about 1 in 2, 50% of adults live with a chronic disease like diabetes or high blood pressure, and about half of adults don't get the recommended physical activity that could reduce and prevent chronic disease. And all total, it's about $117 billion that our country spends annually on health care that could be reduced if we were all getting the amount of physical activity that is recommended. So that's kind of puts it in perspective that it's a big number, and it really adds up. You know, if we promote health and activity in our communities, we can see the effects in the big picture and in the long run. Okay. So now we'll talk about each stage of life and the different challenges and why it's so important for everybody to get a good amount of physical activity. So starting with kids, we know that kids get a lot of their physical activity just by being kids, and we can learn a lot from them. So You put kids on the playground, they automatically start running around, climbing, playing tag. They just kind of are naturally inclined to be active and play. So for those of you with kids or grandkids, make sure that those kids have plenty of opportunities to go to the park or hike or ride their bikes every day, and just make it kind of a fun thing for them. And for kids, we recommend that they get at least an hour of physical activity every day. I talk with my parents in the clinic about the 5-2-1 rule. So kids should be getting at least 5 fruits and vegetables a day, no more than 2 hours of screen time, and at least 1 hour of physical activity. And some of that they get through school, but it's important to kind of get outside and spend that time as a family too. All right, and then getting into the teenage years, this is when a lot of teenagers, get interested in playing sports, either through their school or through clubs, recreational programs. So I encourage my teenagers in the clinic, and for you guys with teenagers or grandchildren, really encourage them to find out what they're passionate about, what they're interested in, and join a team or join an activity that they can include in their life regularly that they enjoy. And it doesn't have to be an organized sport, but they can ride bikes with friends, play football, pond hockey, anything that gets them kind of outside, getting their heart rate up and getting their strength up. So just like with younger kids, give them the opportunity to be active in different ways, to make it just a part of their life as a habit. And then teens also need about an hour of physical activity every day. So that can be a challenge for some families, but that's the recommendation. Then as we get into our 20s, the body's kind of in prime time here. So the body's strong and resilient. It's the perfect time to build that foundation of fitness, to start incorporating it as a habit in your daily life. And that kind of makes it easier if you build that foundation to keep it up as you get older. So a lot of people at this point are still playing sports with friends, tennis, racquetball, hiking or biking, going to the gym, finding an exercise class that works. And then I also remind my 20-year-olds that at this point towards the later part of the decade, you start to lose some muscle and bone strength. So it's important to do it not only because it feels good, but because it'll set you up for a healthy life long term. And I also try to remind people to start including strength training as part of that routine because of that muscle mass component. So I was a big runner in high school and college, and we did a lot of weight training then, but after in med school I started just running, and I thought, oh, that'd be enough, but I didn't realize how important the strength training part is. So you really want to do weightlifting or resistance training too, so you don't lose that muscle mass in addition to your cardio workouts. So the recommendation for people in their 20s is to get at least 30 minutes a day of exercise for 5 days a week, and then aim to include the strengthening exercises at least 2 to 3 days a week in addition to the cardio. And then getting into our 30s, so here's where we talk about losing a little bit of muscle as we start aging. So weight training in this category is especially important. And things like joining a gym and lifting weights, I think makes it easier to kind of schedule into people's routines. And typically at this point, people are getting busy with families and jobs, and fitness can kind of take a back burner. And so I try to remind my patients that it's good for prevention of disease and to set up those habits long term. So things like resistance bands, like we talked about, videos at home, doing those can sometimes be a little bit more convenient, so you don't have to get out and leave your family or your kids. And then I always talk about how bones start to weaken as we get older, so focusing on strength at this point is really important. And then doing some new activities. So sometimes at this point people have done 1 or 2 sports throughout their life, and they haven't tried swimming or dancing or HIT class. And so maybe trying some of those at this point will help mix it up and keep people interested and active, so they find new things that they like. And then in their 40s, this is where we really see that kind of change in metabolism, and people start to notice issues with it being a little harder to lose weight, and they notice their muscles just not being as strong as they used to be. Bone health will start to decline. I see a lot of people in clinic with the complaint of, you know, it's so hard to lose weight in their 40s, and they need some tips and some pointers, but it's not their imagination. It is harder to lose weight at this point in life just because of that decreased metabolism. So it's important, even more important at this point, to have an exercise routine and to continue it so you can boost that metabolism. And then, so we talk about cardio is still very important at this point, 3 to 5 times a week. And then I do see a lot of people in this age group starting to have, you know, some aches and pains, some arthritis, some accidents or traumas that they're dealing with, physical therapy. And so for those people who do have pain in their joints, they sometimes have to switch to more low impact activities. So if somebody's been a runner their whole life and they're starting to have some knee arthritis or some knee joint pain, they can switch to swimming or biking to kind of keep up their cardio, but to make it a little bit easier on their joints. And then walking is always a great option for, depending on people's situations, but that tends to be something that's accessible to almost everybody. And then just as a caveat too, for people in their 30s and 40s, I could do a whole talk on this, but for exercise in pregnancy, the recommendation is whatever you have been doing before, kind of keep doing it. And it is so important for baby and for mom's health and for weight, maintaining weight, to keep up physical activity, even throughout pregnancy and afterwards. Then into our 50s, I see patients having a few more aches and pains and just different chronic conditions coming up, but I always try to emphasize to not let arthritis or obesity or any of those chronic conditions, don't let those stop you from being active. So I always focus on just adapting our exercise program to whatever it is the certain situation is for each person. So I talk a lot about maybe it's time to switch to a low impact activity like swimming or biking or walking. And then I also kind of talk to patients about how you might notice you're a little bit more sore after vigorous workouts, and that's just normal from aging. So we can try to reduce the intensity and then just work out more often. Instead, if people are used to doing an hour or two, we can decrease that and just space it out a little bit more so the body and the muscles have more time to recover. And then the other really important thing in our 50s, throughout life, but in our 50s too, is noticing kind of our posture. And it's really common to curve forward or, you know, lose some of that spinal straightening, and that will kind of weaken the muscles too in your abdomen and back. So the more you can focus on posture and incorporate that into your daily life, it'll serve you well in the decades after this too. And then into our 60s, this is the time that hopefully we've had a good base of physical fitness and we've continued the routine, and now we really start focusing on preventing falls and keeping up the exercise to feel good too. But in this age group, we still recommend getting 30 minutes of activity at least 5 times a week, lifting weights and using resistance bands 2 to 3 times a week to keep muscles and bones strong. So the recommended minutes of exercise is actually the same from our 30s, 40s, 50s, and 60s. The way we do it might be modified just based on our own situations, but the number, I just find that interesting that the minutes is the same recommendation. And then balance, starting to work on balance at this point is really helpful to prevent those falls, and preventing falls is really the big emphasis. And then into our 70s, then we really look towards maintaining strength and flexibility. And this will help us maintain function and maintain independence and being able to live kind of the lifestyle and thriving in this age category. So aerobic exercise You know, things like water aerobics, walking or dancing can be really great in this age category. And then using resistance bands is always a good idea, but especially in this age group where we can do those things sometimes sitting in a chair or throughout the day, which will help us work on balance. And then it's always a good idea at this point too to devote a little extra time to warming up and cooling down so you don't hurt your muscles, just to get them warmed up a little bit more gradually. And that goes hand in hand with stretching every day to maintain your flexibility in this group. All right, and then I get this question in clinic a lot. So how much exercise do I really need? And it varies a little bit by age, but not too much. So for preschool age children, so 3 to 5, we recommend daily activity, active play through a variety of different physical activities, and that can be, like I mentioned earlier, just taking them to the park, biking. They're really good at finding ways to exercise if you give them the right scenario. So one hour a day at least for preschool age children. And then for older children and adolescents, it's about the same, so 1 hour. And they should be doing a little bit more vigorous activities. So running, soccer, hockey, things that really strengthen the muscles, like climbing, push-ups, and strengthen bones, like jumping rope or gymnastics. And then going into our adult years, so from 18 to 64, we recommend, the CDC recommends 150 minutes a week of moderate intensity activity, such as brisk walking, where your heart rate, you really notice that it's elevated. And then in addition to that cardiovascular workout, 2 days a week of strengthening. So that includes resistance bands, weights, and then also some stretching too, like yoga is a really nice way to complement those activities. And then it's for our older adults too, so after 65 the recommendation is exactly the same. So 150 minutes a week of intense activity like brisk walking, running, swimming, dancing, and then 2 days a week of the muscle strengthening. The key thing to add to our older adults regimen and routine is that improved balance. So really focusing on the stretching, the resistance bands, things like that to help us stay in control. And this helps too, just it's a kind of a visual representation of the weekly recommendations. So every day, here's some really good tips for how to incorporate physical activity into your daily life, but doing things like taking the stairs and walking instead of driving, if you can, places in town, doing housework or yard work, and then even parking your car further away from your doctor's appointments, from shopping. That will help you get in a few extra steps every day. And even an extra 10 minutes of walking can go a long way if you do it as a habit on a daily basis. And then 3 to 5 times a week, these are our cardio activities. So running, swimming, brisk walking, biking, and even things like tennis and basketball and skating. And then the 2 times a week of either weightlifting, push-ups, stretching, or yoga to get that muscle strength built up. And then at the very top of the pyramid are things that we should kind of avoid or limit or do less of. So computer time, TV time, sitting, and being stationary. One of my favorite things to talk about with patients too is how do we stay active with arthritis? Because I hear a lot from patients about the aches and pains that sometimes limit their daily activities, or at least their perception. So the biggest things I tell my patients with arthritis about exercise, I always tell them to, number 1, do it. So don't let the diagnosis of arthritis limit your physical activity. And actually, the more physically active these patients are, the better their arthritis gets. So studies have shown that even getting 45 minutes of exercise a week for arthritis patients improves their pain. And each patient will be a little bit different depending on where they have arthritis, but figuring out a routine that works and something that doesn't aggravate the pain is really important. And then I always talk to these patients too about how motion is lotion. So as we age, we have a little bit less synovial fluid in our joints. And as we move them more, we actually can build up that synovial fluid. So it's a great way to counteract the effects of aging and arthritis. And then for people with arthritis too, the more you're able to strengthen the muscles around those joints, the joints actually work, they don't have to work as hard. So you're able to get more relief in those joints, so you won't have as much pain as you're building up the strength. And then we also know that physical activity helps us maintain healthy weights, and that's so important to help with arthritis pain too, because increased weight puts stress on the joints, and so if we're able to maintain and lose weight, that will actually help our arthritis too. And then I also talk about, with my patients with arthritis, just keeping a variety of activities, kind of like I talk to my 20 and 30-year-olds. So you have variety, so you're not getting bored, but you have a good routine. And then my third rule is always to listen to your body. So if you notice you're having pain in a joint, we might need to adjust the routine a little bit. Maybe we overdid it a day. And if you notice swelling, we can use ice and anti-inflammatories, but always check with your doctor and make sure which medications are safe for you personally and your medication regimen. And then, like I said, everybody has, with arthritis, can have different limitations depending on if it's knees or shoulders, and different exercises might be better for one person than another. But there's always something we can do even if we do have arthritis. And then these, I know this font is really small, so I'll kind of tack through it, but in clinic I hear a lot of reasons why people don't exercise. And so I like to do a lot of motivational interviewing and find out what people are able to do. But this just lists some of the common obstacles that people often tell me why they don't have time to go to the gym. So one of the biggest ones is I don't have time to be physically active. And what I talk to patients a lot about is, okay, look at the activities through your week and find at least 3 30-minute spots that you could use for physical activity. And then in the next week, kind of write those in your schedule or put them on a planner. So you can have dedicated time for physical activity. And then other people say, don't have anybody to go with. So places like this, like the Y, is such a great place. You can develop new friendships, join a group. There's so many. Actually, when I first moved to town, we joined the Y, and I said, okay, whatever classes this morning at 10, I'm going to go to it. So I dropped the kids off at the kids center, and I went to the 10 a.m. class, and it was silver sneakers, and it was great, actually. I think I see some familiar faces. But it was Beth Jokey, the teacher, and it was just a wonderful experience because, one, I learned a lot about, what goes on in a silver sneakers class and the variety, and now I can really personally recommend it to patients and say how great it is and what they'll experience through those classes. So, but finding a group or just finding a new class to go to is really helpful. You guys can kind of read through these, but the other ones I hear a lot about are, I'm not coordinated, I'm worried I'm going to get hurt. So for those people, I always say just kind of go slow, listen to your body, and the more you start doing in low increments, the easier it will get, and you'll build confidence. So, and then for other people in my category who say, I have small children, it's impossible, I always tell them about the Kids Center at the Y, because they can have their kids watched, and then they can go and do a workout, get a shower, have some alone time. So this is a great resource that we have here. And then if you're interested in learning more, I always refer my patients to the CDC website. This is a great resource about staying active at every age group. It has really good handouts, really good recommendations, and kind of specific to each condition or stage of life. So this is great if you want to just look more in your free time. So to kind of conclude things, wrap things up a little bit, exercise does a lot more than just improve our physical fitness. It reduces preventable illnesses, chronic disease, keeps us healthy and active throughout our lives. And then coming up with a program that works best for you in your individual life is the best way. So finding that routine, writing down your routine in your calendar, and really having goals for the month and the year, that's a great way to incorporate it into your life and schedule. And then really stressing that exercise is important throughout all of our stages of life, not just when we're older or just when we're younger. It really will be the foundation and set us up for good quality of life as we go on. And then I really encourage everybody to work with your healthcare providers during your annual visits or even during your visits for specific aches and pains or whatever it is that you're going through. Work with your healthcare provider about setting specific fitness goals and getting those written down and being able to have somebody kind of hold you accountable and go through that with you. And they can tailor it to your specific stage and health and fitness goals. So don't be afraid to bring it up if they haven't mentioned it. Okay. Yes, my pleasure.